Living with hearing loss is tiring and it affects people's memory, okay? So when we have hearing loss, it takes the brain more effort, is required to follow and understand. The brain has to work harder to fill in the gaps of hearing. More mental resources are required that can make one feel tired. Compensating for hearing loss leaves less energy available for memory and information recall. Good hearing reduces the workload on the brain. Okay, there was a very well-known study that came out about 10 years ago. It's called the Hearing Loss and Cognition in the Baltimore Longitudinal Study of the Aging. Dr. Lin is one of the lead investigators. He's an ENT physician. The objective was to determine the relationship between hearing loss and cognitive function. He hypothesized that greater hearing loss is associated with lower cognitive test scores on tests of memory and executive function. Okay, and the findings did support that hypothesis. Greater hearing loss was significantly associated with lower scores on measures of mental status. A reduction in cognitive performance associated with a 25 decibel change in hearing was equivalent to the reduction associated with an age difference of 6.8 years on the mental status exam. So, for example, if my twin brother and I enroll at this in this study at the age of 65, we get our hearing tested, and we do the cognitive battery. We both get a score. Okay, let's say our hearing is both normal at that time. 5 years go by, we're back at the age of 70. We do these tests again. Let's say his hearing has stayed normal. My hearing has decreased by 1 standard deviation according to the study, which would be 25 decibels. My cognitive test scores indicate that I'm functioning as someone who's almost 77 years old, not 70 years old. So it was a way of documenting or proving the correlation between untreated hearing loss and changes in cognitive abilities. Okay, dementia will double. Okay, these are some hard facts. So in 2016, the global number of individuals living with dementia was about 44 million, and this was up from 20 million in 1990. About 6 million Americans are living with Alzheimer's presently. By 2050, this number is projected to rise to about 14 million. Hearing loss has been found to be independently associated with accelerated cognitive decline in elderly adults. The opposite statistical trend is observed in participants that used hearing aids. Cognitive decline for those who used hearing aids was not significantly different for those without hearing loss. Okay, so it is important to say that will getting a hearing aid prevent cognitive decline? We would not say that. What we would say is that we can manage a condition that's manageable while we help the patient deal with something that's less manageable. Okay, so if we can manage the hearing loss, at least we're making it easier for that patient to communicate while they're going through a challenge like cognitive impairment or dementia. And it also makes it easier for their family members and people taking care of them. Okay, there's also an association between hearing loss and dizziness or imbalance. There's an anatomical proximity. A shared nerve, the 8th cranial nerve, is associated with both hearing and balance. People with mild hearing loss are 3 times more likely to have a history of falling. Every additional 10 decibels of hearing loss increases the chance of falling by 1.4 times. We have an example that I discuss. I call it the hallway example. So let's say someone is walking in the hallway in a school, and the school has a very shiny, hard floor, and the person is walking with shoes, like dress shoes, and they're going to hear their footsteps. With every footstep, they'll hear it. If they had their eyes closed, they were walking down this hallway, and they walked past an open door, the sound of their footstep would be different than if they walked past a closed door. Okay, so I think that's an example that most people can relate to, and hopefully that example will illustrate the fact that environmental sounds give us information about our environment, okay, like basically where we are. So think of a blind person tapping a cane. They tap the cane not only to get the feeling, but to get the sound, to hear the tap, tap, tap. If they tap it next to a wall or in an open space or in their kitchen, they're going to get a different quality of the way it sounds to them, and that's going to give them information about their environment. So imagine losing that. You also lose some safety information that hearing is giving you. Okay. Consequences of untreated hearing loss. Adults with untreated hearing loss experience 30 to 40% faster decline in their cognitive abilities and are likely to develop dementia. 12% of those over age 50 report hearing loss that is significant enough to reduce their understanding of their treatment plan when they're getting medical advice. And this group has a 32% higher rate of hospital readmission. And that's from statistically from the American Geriatric Society. The cost impact of untreated hearing loss over 10 years is about $22,000 per person in additional medical expenses. Benefits of appropriate amplification, okay. Increased safety, greater independence, better communication with friends and family, better communication with healthcare providers, reduced perception of tinnitus, mitigation of cognitive decline, overall improvement of self-confidence and quality of life.